Hey, deserving listeners, couples therapy, let's watch.
There's something there, as horrible as it will be for me, you can't live your life this disabled.
Right. So I think Annie, one, feels shut down completely by Mao, but a little bit by the therapist, because the therapist was saying, no, I think let's give him the benefit of the doubt. So this is a bad moment for everyone, Annie particularly. So obviously they didn't show the full session. Maybe they had some levity toward the end. It kind of looks like they did. They're smiling. But sometimes sessions just end like this. Sometimes I usually try to taper things off in the last few minutes, but sometimes things end real rough in couples therapy. And I'll talk with couples about that. Sometimes in the moment, I'll be like, okay, I kind of feel like we're ending the session in a kind of a rough time. And what I recommend the two of you do is take maybe a few hours apart to think about things and to regulate and to get some balance before entering into a conversation again. Because because I've had clients, as soon as they leave the session, they argue the whole way home because both of them are triggered. And that doesn't really do any good if I can't be there to help them to communicate. And so sometimes, or we'll do a breathing exercise. Okay, everyone, let's relax. If you can hold hands, that kind of thing. But sometimes you just have to end sessions at really rough moments. And as a therapist, what I learned early in my career and what I do for my trainees is you just have to be okay with that. And you have to know that everything will be okay, and the vast majority of the time. What I used to do and what a lot of novice therapists will do is they'll feel so responsible for like piecing things back up and having things be all nice at the end of the session that they'll go over in their sessions, and then their next session will be pushed back. And of course, that's just the therapist anxiety causing problems for the next therapist.
Them jumping ship. I have to maintain a connection with him on his terms. Otherwise I lose them as a couple. Sometimes it feels like...
I will say, just a little comment here, two things. One is she's struggling, which is normal. Couples therapy by far has the most countertransference. There's a lot of theories as to why that is. I've never really liked any of them, other than to say that when there are two people in the room, as a therapist, you can't side with both of them at the same time all the time. With an individual client, you can side with them. And when you're confronting them, you can do so at your own pace. But things happen so quickly in couples therapy, and there are many situations, particularly with this couple, where you feel like in order to help someone else talk, you have to push back on someone else. In order to validate someone, you have to sometimes invalidate the other person. Or it's not active invalidation, but it can feel that way, and you can feel that, and the clients will react to you. And I don't know if people think this, but I feel like there's this cultural notion out there, and a lot of therapists have this, and I work with my trainees on this assumption that couples therapy is short term. Like, let's just go on for 5 sessions and we'll wrap everything up. No. The couples that I've worked with for years, and their issues, they get better over time, but it takes a long time. And for some couples, they're probably going to be working with me for the rest of their lives, as long as my practice is open. I don't know that. It's up to them, of course. But I've worked with couples for years and years and years, and never at any point do I think, shouldn't they be done with therapy? Most couples, if not all couples, could benefit from a couples therapist at least once a month, if not more often. There's just so much trauma that we have from our early lives and with each other and with our earlier relationships, and oppression and sexism and racism and stress and overworked and pressures to be the perfect parent. Like, there's just so many pressures on our lives that it takes a toll on our relationships and in our romantic relationships. So anyway, That's the first thing I'll say. The second thing I'll say is she has a dog in the therapy office. And this is a trend that I've been seeing more recently, which on one hand is great because I love animals, as you all know. But and a lot of clients really love the animals to be there. But you have to do it in this very careful way. And I've seen a lot of therapists do it in a very uncareful way. Where essentially, so let me talk about the formal usage of animals in therapy. You can actually get trained in supervision on how to use animals, whether it be horses. Obviously, it's not in an office. You actually go to the ranch or something. That there's a form of equine therapy, or you can have dogs or cats, and it's a form of therapy like yoga therapy or drama therapy or dance movement therapy or art therapy, and you have to be trained on it. And there are ethical codes and there are guidelines, and that's great. And also you have to have clients know that that's what they're signing up for. If you go into a therapist office and you're wanting trauma therapy and you don't want to work with animals and they just spring on you, by the way, I have 3 dogs here that you're going to be working with, you're going to be like, this isn't what I signed up for. And as a client, you might feel bamboozled a little bit and coerced into the situation because you don't want to insult the therapist, and so you go along with it. So it needs to be very disclosed right from the beginning when they make the point. By the way, I use animals in my therapy. Is that okay with you? That kind of thing. So there's a whole field of using animals in therapy. But what I'm finding is a lot of therapists, without getting that training or the supervision or knowing the guidelines or knowing anything about it, they just bring their pets to the office because they don't like to leave their pet at home, or they just like their pet there. And I've seen there's a spectrum there. With some pets, they just sleep all day. And so there's no interference in the session. And it seems like for this therapist that's what they're looking at, is the dog's, kind of friendly, but then quickly just goes to the bed and lays down. But some animals are extremely in your face, and they jump up on the couch and they're getting in your face. Now, if you're using a form of therapy that utilizes that action, and you disclose to clients beforehand, and you get training, and you're continually checking in, then great. But what I see a lot of therapists do is they just bring their obnoxious pet and they're lovely pets, I'm sure, but when people come to therapy, they don't necessarily want that, and they're paying a lot of money for it, and they don't want to be distracted by your pet. And so it's a disturbing trend that I've been seeing, and it needs to stop. It looks like this is okay, but and maybe she has training, and I have no idea. But I just wanted to throw that out there. So for you therapists, I hope you're listening to this. If you haven't heard this soapbox of mine, and if you're a client, you have every right to say, you know what, I don't like your animal. Like, I love dogs. Like, let's just say for me, I love animals. I love dogs. I love cats. I love pets. Love them. And if I had it my way, I would have, I don't know, dozens of cats and dogs on a big ranch somewhere, and, it would just be this wonderful time. But if I was a client and I had, when I go to therapy, I want that kind of conversation. I want that back and forth verbal thing. And if I had a dog that was like jumping up on me, when you go to someone's house and you're in your nice clothes and you're like, oh, okay, and it's jumping up, getting I would like the dog, because of course I like dogs, but I'd be like, I'm not here to play with your dog. I have a dog at home I can play with. I'm here. I'm spending a lot of money. It took me a long time to get to the office. There's a lot of time involved in this. Let's get to therapy. And I don't want to have this. And also, even though I'm a pretty confident person, I probably wouldn't say anything to my therapist because I'd feel bad. I would feel like I'd be insulting them if I said anything. Like, hey, could we not have the dog in session? I probably wouldn't say anything because I would feel like I'd feel too bad about it. So it's really important that therapists know what they're doing, ask their clients, is it okay? And if a therapist asked me, is it okay, like, say, at the end of a session, like, so sometimes I bring my dog into the session, is that okay with you? I'd be like, no, I don't. I love animals, but I don't want a pet. It'd be too distracting to me. So you need to have that conversation anyway. But let's see what else she says here.
In a way, I have to sacrifice Annie to stay tuned in a very particular way to his way of speaking, because he's so sensitive to any diversion from the way he sees the world. He experiences it as such an assault.
Right. It's an accurate conceptualization, I would say. And yeah, that's the problem with couples therapy. It's really hard. So she's saying any criticism he considers it an assault, and so I need to create space for him because otherwise he'll shut down. But in order to do that, I kind of have to ignore or not provide enough empathy to Annie. Now, there are ways to do that, and if we rewind the clock back to that moment, let me sort of, and it's always easy to armchair therapist, but one way to do that in the moment would be something like, so in that moment, Annie was saying, "You traumatized me," and then he's saying, "I'm hearing you," and she's saying, "There he goes, dismissing me again." And then the therapist, "Well, wait, Annie, let's give him the benefit of the doubt here." So it's kind of shutting down Annie a little bit. Okay, so what could you do here? You'd be like, "Okay, Annie, I get it. I get that it feels that way to you, and I want to value that. You've been in this conversation many times, but I want to give a little bit more time for Mao to explain himself, okay? All right. So you see the way I demonstrated that is I can validate while also getting what I want to have happen, which is to create space for Mao to talk. Whereas what Annie did was say, "I don't think that's what's happening, Annie. I don't think you're right in the fact that he's dismissing you. I think he has empathy and we need to hear him out." And I think Annie felt like, oh boy, really? He is dismissive to me all the time. He's dismissing me now. And by you creating space, it just created more space for him to yell at me and dismiss me more. And you, as the therapist, believe that I'm crazy for thinking that he's dismissing me. So that creates a lot of tension. And I've done that before. I mean, as a couples therapist, I have made that mistake countless times.
Right. I'm not sure if I'm indulging him. Could I confront more? Could he tolerate it? Or would that blow up the treatment?
Right. And the answer is no. You cannot confront him more. It's already really rough for him what he's doing. And this is a very classic conversation that I have in supervision with couples therapists that are in training. And what I'll say is you just got to write it out. You just got to give it some time. It's going to take a lot of time. Confronting him, do you think that's going to work? You've tried a little bit of confronting and it completely failed because he's so relationally traumatized. So you have to give it some time. Now, one thing you can do is you can meet individually with each person. And when you meet with Annie, you don't talk crap about Mao, but you do say things like, "I get what you're going through. This is going to take some time. There might be some moments where in order to help him to heal, I'm going to have to create a lot of space for him. And you might feel like more space, he's taking up more space than you are. But just know that I'm doing that on purpose because he's got a lot to sift through in terms of his relational traumas that have never been discussed before. And until he discusses them and has that connection between his past and his present, has some emotional awareness and intelligence, it's going to be hard to move forward. So I might have a conversation like that with Annie to help Annie feel like, okay, this is necessary. I'm kind of being shut down right now, but the therapist explained to me last session that that's a necessary part of it, and that's okay. It's a dicey situation, and Annie would be perfectly in the right to say, well, I don't want to do that kind of therapy. And I'd be like, okay, well, let's see what we can do.
Very tightrope I'm walking on there.
Yeah.
All right, well, that does it for that episode of Psychology in Seattle. Everyone out there, please take care of yourself because you deserve it. You really, really do.